All right, so welcome everybody out there in social media land. We are the Flint Public Health Youth Academy. I'm Dr. Kent Key, the director of the Academy, and we are here to really talk about the work that these dynamic interns have been doing as they give youth perspective, not only to the areas of public health, but almost to every aspect of life for young people, for adults, and for communities, not only in Flint, but across the country. And so we're delighted today to have our interns here. I'm going to just let everybody just kind of throw their name out. Sometimes the people send me little messages, say, hey, so what does Amir do? Who is Amir? What is Kayla doing? Who is Kayla? Right. So I'm just give the viewers your name, let them know what age you are, if you want to share your age and where you are in your education, if you're in college or if you're still in high school. And one of the things that has really grasped you about public health since you've been a part of this program. So I'll turn it over to whoever wants to go first.
I'm gonna hop in. My name is Kayla Shannon. I am 20 years old. I just turned 20. Virgo season, woo woo. Anywho, I am a sophomore at the illustrious Spelman College. I'm majoring in political science and pursuing a minor in philosophy, so lots of reading. And one thing that has really grasped me about public health is its ability to connect so many different communities and on so many different issues, but also to take a deeper dive into the roots of systems and institutions that have caused larger public health crises in different communities. So I just love the fact that it's real. There's no way for public health to be elusive, right? Like it's real frank, it's real, here are the details, here are the statistics, there's no denying, and this is what it is.
Okay, so I'll go. Hi, my name is Amir Ellison Brown. I'm currently a junior at UM Flint. And so what I like about public health the most is kind of what Kayla said. It really ties in a bunch of different communities together and makes it, develop overall into a better environment for people to live and, be prosperous. So that's what I like about public health.
Hi, I'm Cruz Duhar. I'm a 20-year-old junior English major at Morehouse College. The reason why I like public health is because it has a deep concern for population and people in general. I like to believe myself as someone that is a humanitarian to a degree. And so I think it's really important that public health focuses on all different aspects of how people are impacted. And that's really important to me, especially as someone who is concerned with activism.
Hello, my name is Everett Graham. I'm 16 years old and I go to Southwestern Classical Academy in Flint, Michigan. The biggest thing I like about public health is that it is like ever changing. The world every single day is changing. Everything is different. There's always stuff happening. There's always lots to learn, especially when talking about public health. Like Kayla and Amir and Cruz said, it's very diverse and like there's a bit of public health in everything. So it's really fun when I get to meet people and teach people about public health and like different, careers or stuff like that.
Everett, I don't know if your background is different than it usually is, but like it's such an aesthetic. Like I just had to comment. Like you have a whole thing going on, and I really appreciate it.
Thank you. I don't know. It's the same. It's that time of the year, my favorite time of the year. It gets dark quicker, so the sun is a little bit more mellow. So I'm getting that good light in right now. I look good. I feel good.
Anyone else want to introduce themselves? Dr. Bailey, Khalil, Monisha, Kiera.
Well, hi, I'm Dr. Sarah Bailey, and I'm just so delighted to be a part of the learning and actually learning myself because I'm a continual learner. I don't think you ever stop learning if you don't want to. I've been involved in public health for more than 50 years. But I love it because being involved with the Public Health Youth Academy keeps me fresh, keeps me young at heart, and seeing things from a youth perspective as opposed to someone who's just, okay, it's the same old, and nothing's going to change. There's a youth perspective out there that encourages one to work harder to see things manifest and change. Some things stay the same, but lots of things can change.
Thank you. Jasmine popped in with the hair. Loving the hair, Jasmine.
Thank you.
We're just doing brief interviews to our studio audience, introducing who we are, what you do, and then why you love public health in this program, basically.
Awesome. Has everybody else gone?
No, but go ahead.
Oh, no, I'm not ready yet.
I could go to fill the awkward silence. I'm Kiara Wallace, and I am paralegal at the National Treasury Employees Union, and I also go to University of Maryland for law school. I am in my second year, and I'm not going into health law at all, but my interest is really just because of the students and what they're doing, and really learning about public health and how it's impacted our community, and just being able to support you guys however Dr. Key sees fit.
And you are a Flintstone. So everyone that's watching, all of those, the illustrious Spellman and the illustrious Morehouse, and you got Kiara over there on the East Coast, they're all Flintstones and from the Flint, Genesee County area. And your glasses are popping, by the way. Who else?
I can go. I was trying to wait. It was loud over here. But my name is Monisha Summers, and I work at Michigan State University. I have been there for 4.5 years working in the public health field. I'm currently working on a research project with COVID antibody testing. I enjoy working with the youth. It helps me to learn more about public health as well. My background is in podiatry, so this is a learning opportunity for me as well. And I'm from Flint, and that's about it.
Thank you.
I'll jump back in. So, hi, I'm Jasmine. I am one of the mentors with Flint Public Health Youth Academy. I'm also an epidemiologist, and I wear several other hats in the community. Some of what I do is, one thing that kind of ties me to Dr. Key and to Dr. Summers, and several others, is working at MSU, Division of Public Health. I work at the Flint Registry. I am also the Director of Wellness and Environmental Justice with Black Millennials for Flint, and the Health and EJ Chair for the NAACP. I absolutely love public health. I loved it before I knew that there was a term for public health. Kind of like Dr. Key and all the youth always say, like, public health is everywhere, and this is a great field to be able to make a difference in, because we have to live, we have to keep our environment livable, and to do that we need all hands on deck. So
Thank you. And I think we have last Khalil.
Hey, can everybody see me?
Yes.
Well, I'm Khalil. I've been working with, the public health with Dr. Key in the public health building in Michigan State for almost 3 years. And the thing I love about public health is just the scale of it. It's amazing to see how much this one little field can impact so many different things around the world, in our communities, and how we can use it to make every place better. And I'm pre-med, but I had never thought about combining getting an MD and an MPH until I actually started working here. And I realized how important it is to have like a foot in both fields. So that's what I really love about it.
And Khalil has his applications in at some medical schools, and We're going to be sending positive energy and prayer and
I
all of that
appreciate
so
it.
that he can be favored to be where he would like to be and where he can really be his best self and show up in his best self. And so I'm pretty excited about this. So before we kind of move into the conversation, you mentioned something, Jasmine. You talk about epidemiologists. I'm gonna be honest. If public health as a field misses this opportunity, I'm going to be just so upset with us as a field, because since COVID, everybody is talking about public health. Everybody is talking about epidemiology. You know, Dr. Fauci is an epidemiologist. They have him there because he's an epidemiologist, not because he's an MD, right? And we do have, I will say, prior to COVID, the trend in the field is that we started seeing more MDs coming back getting MPHs, right? And now you have people like Khalil who's going to medical school, who's getting their MDs and their MPHs, because they understand that being an MD, you're dealing with an individual at a time, but as an epidemiologist or a public health professional, you're dealing with population level health and those factors that impact our health. And I will point you guys to the Robert Woods Johnson Health County Rankings model. If you were to Google that, you'll see that only 20% of clinical care actually impacts our overall health and our overall well-being and length of life. And so when we talk about the importance of population health and community health, then I think even the medical field is understanding we need to have a public health approach, perspective, and view as we deal with things. And so that's pretty wonderful. So you mentioned epidemiologists. Jasmine, can you in a couple of sentences tell our viewers who may have never heard that word other than when they hear Dr. Fauci, what does that mean to be an epidemiologist?
So epidemiologists study distribution of disease. So it's like math and science put together. We look at, you know, with COVID, infectious disease, how much is this coming up in our populations and how do we prevent or control it? I'm specifically a neuropsychiatric epidemiologist, so I look at brains and mental health. I'm interested in what does depression look like in African Americans and how can we prevent it? You have people working in, you know, cardiac epidemiology. You have people doing cancer epidemiology, and it's the folks who are looking at the data around specific populations to figure out how is it distributed. In some cases, doing actual experiments to try to figure out which types of public health programs are going to be the most effective, which types of policies might be the most effective. We're the math and science people put together.
And so I'm a piece of that, but I'm a health disparities researcher. And so I'm looking at why are there disparities? And that's just a fancy word for saying differences between different populations. When you would think if everyone lived in Genesee County and lived under the same environment, that there would be the same outcomes. But we know that for across this country, communities of color, specifically African-American communities, suffer disproportionately when it comes to diabetes, when it comes to cardiovascular, when it comes to heart disease, when it comes to stroke. I mean, we can go across health indicators. And I want to research and investigate why is that? Is it because of social determinants of health, housing conditions, socioeconomics, education level? And so I look at disparities across health indicators, specifically across the life course, not just in youth, not just in adults, not just in seniors, but across the lifespan. And so that's kind of where my interest is. And I'm just so excited that we have so much that we can offer as the Flint Public Health Youth Academy. So when we talk about this, and before I get into some of the programmatic stuff, we're always going to start initiating a hot topics component in our show, especially if there's some hot topics that are out there. So one of the hot topics in the world of, I would say pop culture, social culture, and everyday life across this country is this whole mask mandate regarding COVID, right? I don't know if you guys are aware, but in Genesee County, our health officer and many people in Genesee County Health Department have received death threats against their life because so many people are totally against mandates. I talked to some other folk in other parts of the country and in other counties, and their health officers and leadership are receiving the same if they have issued those mandates. And what is you guys, let's talk about that. Like, come on, we're talking about health and people are actually threatening the lives of the individuals who are trying to save young people's lives while they're in school if they're enforcing a mask mandates in school. You guys are young people, whether you're in college, whether you're in high school. What are your thoughts on mask mandates in institutions of higher education?
For me, it's sort of a no-brainer, right? We've seen the statistics, we've seen the impact, we see the effect. We, especially in states who used mask mandates during like the height of the pandemic, or at least the height of the initial wave of the pandemic, which Michigan was one of those states, right? We saw the difference between when people were wearing their masks and were in lockdown and were under restrictions that, although were uncomfortable, were ultimately effective. It helped to reduce the numbers, right? And it wasn't necessarily we understood, or at least the people who did their research understood that the point was never to ultimately stop the infection, but more so to slow down the rate until we could find something that would help us help our immunity, right? Until we have vaccines that are going to help with herd immunity and things of that nature, we needed some sort of precaution to take to slow the death rate. Like the death toll was ridiculous. And one of the reasons that the death toll was ridiculous is because some states, counties, whatever the case may be, often ones that were red, or Republican or conservative or whatever you want to call them, did not take it as seriously and did not take the precautions because they didn't believe in them. But once again, the statistics tell otherwise. The statistics tell stories that these protective wear works, and it once again is uncomfortable for many people. It's not fun. I don't think any of us jump for joy at the idea of like wearing a mask or two over our face all day, right? But it's really a decision between, it's a life and death decision. That's what we're making every day. Thankfully, we do have a vaccine now, so we do have something that can help our immune systems to cope with this infection. However, there are variants, right? And so even that like changes this. And so for me, in spaces where large groups have to gather, such as currently places of higher education and primary education, it's just a no-brainer.
Anyone else? Thank you for sharing that, Kayla. Anyone else want to chime in on this whole mask mandate piece?
Well, so we are in person and we have to wear masks as well. And there was a recent email that our dean sent about requiring students to wear KN95s now. And Thursday, they actually passed out KN95 to the students. And so all of what Kayla said is accurate and important, but the thing is, we shouldn't be back in person. So what Kayla is talking about applies to the general population in general life. But as far as higher education, the bottom line is we shouldn't be back in person. And I'm not sure why all these people in education who made these decisions, but to tell us 5 weeks into school that we're now required to wear KN95 masks means that you know that we're spreading the virus. We're not at 100% vaccination on campus, and now you're concerned. So you can't, I'm not sure what other schools are doing, but you can't do both. I don't think most of these schools had a plan as far as what they were going to do to go back. They just wanted to get back in person. And I'm not a parent, but I have plenty of nieces and nephews. And I'm sure that, you know, moms and dads wanted to get their kids back out of the house too. But the bottom line is, first of all, primary children don't have the mental capacity or the understanding of germs and how they spread to accurately protect themselves from the virus. And us older students who are in college and in these higher education institutions where they're not appropriately applying rules that they should be, are just at risk for no reason. There are 75 people in my con law class. that room is not socially distanced. It's impossible for that room to be socially distanced. And when we brought up these concerns, their response was, if everyone's vaccinated, then we don't have to do that anymore. But then 2 weeks later, you tell us we have to wear KN95s. So number one, I know for a fact that we're not all vaccinated. And I'm not sure why you would make something like that up, because, on top of the very few people who actually have a religious exemption, there are a lot of students who just push back for no reason, which is their personal preference. But the bottom line is we shouldn't be back in person. Administration is making these decisions and not thinking about how they're actually going to be implemented. For example, I'm on full telework for work, but sometimes I do have to go back in the office if we have to file in federal court. I wear my mask in the hallway, I wear my mask in the bathroom, I wear my mask to go get water. But when I'm in my personal office, I don't have my mask on. And that's what administration does upstairs. But as a student, I have to have my mask on for 3 hours apiece for each class. If I want to use the library, I have to have my mask on for however long I'm going to be in the library. I have to have my mask on in the study sessions. So outside of a medical professional who's a doctor, emergency, or something like that, who has to wear PPE, which is not what KN95 is anyway, I don't think the masks were designed for us to sit with them for long hours on. I'm not opposed to masks. I just think I don't understand the thought process in making us go back in person if they making us wear masks and passing out one KN95 mask to everybody for the 6 or 7 weeks we have left for the semester. I just don't think it's accurate. And there was the little girl in Texas that died 2 weeks into school. She was a Black girl, middle school. I can't remember her name, but in Texas, a Black girl, as soon as they went back to school, got COVID and died. So across the board, across the states, this is where we at.
And so, and it's ironic because we are starting to see, I'm at a higher institution of learning, and those that work there have to verify that they have been vaccinated. And I believe that there will be mandates, if there hasn't been, for students to be vaccinated at some point. I think most universities would eventually adopt that. But I'm so with you, Kayla. I'm sorry, Kiera, on this, because it is so much. It's so many things and so many factors to weigh into these decisions that it would really be good if people really understood what the rationale of leadership in these educational institutions, how they came to the conclusions that they came to make the decisions that they made. Anyone else want to weigh in on, like I said, I kind of started off with the health officers in Genesee County and others are receiving death threats because of mask mandates for youth in school. Cruz, I saw you come off of and then Amir.
Okay. I mean, it's always a feeling of not being safe. I can't speak for everywhere, especially because I go attend Morehouse College now. But what I can speak for is this sense of resistance to wearing the mask. So when we even get along the lines of there being mask mandates, people also just don't listen, and it's not safe. And that's really concerning because it's this thing is definitely spreading. There's definitely new variants. And, when it comes to thinking about how it could impact you and then potentially your family, I know I'm not talking to nobody after one of the breaks. Once we come home from winter break or Thanksgiving, I'm definitely not hanging around these people. And that's because you just get this feeling of, man, who is really looking out for this? Because administration, I could tell you why a lot of them are having people go in person. It's because COVID, just like how it affected everyone as individuals, it affected institutions as well. And so now they feel this need to have us all in person because money is on the line now. They definitely didn't make as much money with us being at home. And so they're not really concerned as much about our health as they are concerned about, I guess, sustainability. But, that puts up the ideas that you're just is this something that we really supposed to be doing? And, I'm actually sit in the middle because I would want to be in person. But that being said, I would want things to be implemented to where I am safer, to where these concerns I no longer have That way I can actually, go home and not feel like I'm potentially putting my family at risk. And the whole vaccination thing, yeah, most places are not 100%. And a lot of the times, institutions don't necessarily want to talk about that either. That's a whole different thing. It really is.
Okay, and I see that you guys gave me a prompt, so the order would be Dr. Bailey, Amir, then Everett. Thanks, Kiera and Jasmine.
Actually, I was saying that I did not have my hand up, but I will go since you called on me. The mask mandate here in Genesee County has taken it, folks have taken it to a whole nother level. And Dr. Key is aware that part of our group has been attacked as a result of the mask mandate because we can't come out on the side of either get vaccinated or wear a mask. I mean, come on, there's only two things that's gonna keep you safe. When it comes down to it, it's all politics. If we don't talk about the fact that this is this is no longer in the arena, which I was hearing Kiera say that she's in law school. Eventually, public health is a matter of law. And so there is a correlation between those that are empowered by the law as opposed to just, doing something that's part of a policy or what have you. And to see some of the lawmakers actually come out against mask wearing, and then that trickled down into the schools. And we're talking about little kids who we had not seen the level of actual COVID disease in them because we kept them away from COVID. They were out of school, they were out of the public. The moment you put them back in school, we're finding that a lot of these kids are carriers of COVID. They carry a lot of the disease in their nasal passages and then in their orifice. So what we're finding is that they are what we call super spreaders. So they need something that's protective, between one another. Now we know they're not going to keep the mask on all day long. We know it's going to get dirty. We know, these are little kids with snot and boogers, and we know all of that. But that's the reason why there are adults there to when that happens, to help them by helping them change those things out and do those things. The problem with the folks in the higher institutions, I'm livid with, because these are some of the folks that I know personally, and I think they're nuts because the dollar is driving their decision making. And eventually, this thing is if we don't get a hold of this thing, it won't matter about the dollars. The dollars won't matter anymore because you won't have anyone to actually attend school. Start letting kids start getting COVID at a really high rate as a result of being back in the classroom, and let those lawsuits that those parents start bringing towards those institutions. We haven't seen where this is going to go yet. So I'm looking at it from a holistic point of view. And Kiera, we need you to study that law, study the corporate laws and those laws that direct policy, because we need to know what foot that we need to stand on, especially when we've had it declared, we had racism declared, and we've had all of these things declared public health crises. These are COVID, quite not, it's part of the racism as a covered public health crises, because we know disproportionately African Americans and people of color, low income people, marginalized people are the ones who are dying as a result of COVID. We need to really deal with this issue. And
right, dying the most.
Dying the most. And we need a mask. Basically, you can get a KN95 mask for $5, for less than that. And the health department gives them out for free. So I don't know what else, we need to do.
Thanks, Dr. Bailey. So it'll be Amir, Everett, then Jasmine.
Yeah, so personally with me, like, so I think like the institution that I go to, the U of M umbrella, kind of they really like made sure that everyone is vaccinated. And plus, we have to do like a health screening before even going to certain parts of the school. So I think that's very safe. And it's crazy to see like on TV when they have all these like college football starting up and everything, and you see a bunch of people in these huge stadiums packed in together, and I'm like, oh my God, like this is not gonna end well. And I think we just have to really be aware and vigilant because like Cruz was saying about like Christmas break, different things like that. When people go home and stuff like that, you don't know if their relatives or family members have gotten the vaccine or anything like that. And so when you come back from like holiday season, it's gonna start another little turn up and wave. And so I think it's just important for people to wear their mask and try to get vaccinated when they can, because it's not stopping anytime soon. It's like, it's not just gonna stop for you. So just to protect other people, be safe to wear a mask and get vaccinated.
Okay, I'm sorry about that. My screen is lagging, so I'm trying to get it together real quick. But give me 1 second. Okay, my little 2 cents on it is, as someone being in high school right now and just kind of seeing all the different things going on as far as like the mask mandate, people, against it, people who are like okay with it, but like not really following it the way it's supposed to be followed. The more like we go on, the more we see. I just don't see how like they expect to hold this in-person schooling up long term. A couple weeks ago, school started in Michigan, and we had multiple different schools around the area where students had different boycotts, where they were boycotting wearing masks in school just because they felt like it was restricting. To them, it was unconstitutional, which I don't really know what that means. But you just see how like it was instantly problematic. And then you see how along with that, the numbers instantly started rising. I think we were 2 weeks into school when we had our first COVID case. Luckily, we had an intercession at our school where we had a week off of school. So things kind of died down after that. By the time we were back at school, the people who had got COVID had already been taken care of. They were already, quarantining and like getting what they needed. But it's not the same for other schools. Just in the first month of these schools being open, there's been countless COVID cases and they're only rising. Like I said, we literally just got back from our break and there's already another group of COVID cases. So it's crazy to see how people are still, okay with, in-person school, and they're just expecting everyone to kind of be quiet and go along with it when obviously it's not safe, it's not maintainable long term. And it's just kind of scary to see, because the people who are, supposed to be protecting us, who are supposed to be helping us, are the same people who are being attacked. Like Dr. Q was saying, getting death threats and like constantly dealing with thing after thing after thing. Not to mention it's Flint, so they got 10 billion other problems that they got to deal with anyways. It's just like very scary to kind of live through. Kind of, I got to take care of myself. I got to take care of my family. That's number one. But I also got to get an education. Like I can't not go to school. And they are offering different, options. But as someone who struggled in online learning last year, where that was like the only option, I can't, let myself be like, I'm not going to school just because I don't feel completely safe there, and then let my grades or let anything else fall because of fear. So that's my take on it.
Yeah, that preach. And when it comes to mask mandates, for me, it's a matter of just respect and concern for your fellow person. It's like we should be following these rules because we know it can keep, if it saves one life, it's worth it. Like these masks are not that uncomfortable. 600,000 deaths is uncomfortable, like, period. And
I should be uncomfortable. 600,000 deaths should be uncomfortable, but clearly.
Right. And I think about, like, where is the federal mask mandate? That should be the policy. It should be something that across the board, we can't do this politicking, because we know what the science says. We know what literally the evidence that we have seen says. Like, that's something I would love to see, is a federal mask mandate. I would have loved to see it back in March of last year when Dr. Fauci and them were saying maybe not masks, you know. And I think that goes back to this whole like confusion with some of the public health messaging. I think when it comes to Genesee County specifically, it's surprising that we're having this conversation still. Like, we have had an overwhelming share of cases and deaths as far as COVID, and we're only about halfway vaccinated. You know, about half of our population has been vaccinated. So we should be wearing masks anyway. Like, this Delta variant is real. This Delta variant, I mean, these breakthrough cases are real, and sure, you might not be hospitalized, you might not have severe sickness from COVID if you are vaccinated, but you could, and it's not worth it. Like, it's not worth it, especially in African Americans, because we know how we've been doing as far as COVID, and we know how few of us have had our vaccine. So we need to be the first ones and the main ones with our masks on, period. And then finally, when it comes to institutions of higher learning, just like several people have said, they need to stop. They need to just stop. Like, go back to virtual. What are y'all doing? And then as far as K through 12, so there's a legitimate reason for young kids needing to be in school, especially after being out for a year. And honestly, if adults weren't politicking about it, kids will probably be wearing their mask and not even feel the need to protest or feel the need to fight it. Because the kids understand and kids have empathy. And as adults, like, we should be vaccinated and we should be wearing our masks, setting an example for these kids, instead of doing this back and forth. So I just say all that to say, federal mask mandate, please.
Great. Monisha, then Khalil.
I just have a quick comment. My son, he does go to daycare. He's 2.5, so he's not going to leave a mask on. So I do believe that as adults, because we understand, we should have masks on, because some kids are too small to understand. And so it's always a struggle for me to take him anywhere because he won't wear a mask. Where we went to Hurley Hospital's urgent care last week, and a person was upset with me because he did not have a mask on. And I had to explain to them that he's not going to leave it on. But really, in my opinion, it was none of their business as to why he didn't have one on, because that's my child and I know what's right for my child. But he was actually had a sinus infection. We both did. So we were tested for COVID. We did not have COVID. They did both tests. They did the PCR and the rapid test. But, I was being chastised because my son didn't have a mask on. But I mean, at 2, what he does is he puts the mask on, it gets wet, so he throws it off. So he'll have it on because he's licking the mask because it's just like, a little kid. And so for me, I'm like, if adults would have a mask on, then these kids would be okay, because they don't, up until the age of 4, they really don't get it, so they're pulling at it and so I'm like, we are the ones who understand better. So why can't we just wear a mask? It's just so frustrating to me to have a kid that doesn't understand, and I have to go places and he has to go with me, and he doesn't have a mask on. And then I see so many adults at Target or Meijer, and I don't have a choice. I have to take them. Or I see newborn babies in there with their parents, and they have to take them. And so sometimes I don't put on a mask because I'm like, I feel guilty. Like, here I am protecting myself, but he's not protected. It just is very frustrating. So I wish, like Jasmine said, it was a federal mandate so that everybody would, because it's just very frustrating to have a kid that age and they're not able to put a mask on because you're afraid. I don't want him to get sick, but I mean, what can I do? I can't force other people to put masks on.
Thank you. Khalil.
Yeah, I just wanted to quickly say that mask mandate seems like the least you could do. It's considering how many people have been sick, and Jasmine said 600,000 people plus have died. And it seems like it's the least you could do to protect yourself and others. But to take it a step further, I'd be also okay with the vaccine mandate, because that's how we got rid of so many diseases in the modern world, having a huge population vaccinated for a disease. We got rid of polio, a few others. We had measles gone for a while, but that's come back because of anti-vax people. But yeah, like I'd be okay if we took it even a step further.
So Khalil, you got, and the rest of you, you guys really pushed a point I wanted to really make. First of all, the need for a vaccination is not new. We've had it historically. The only difference is political parties have been able to politicize COVID, whereas polio, that was a health issue. And, you know, chickenpox or any of those other previous things that we have vaccinations for, those were considered health issues, but they have made COVID not only a political issue, but then also race baiting it, right? And so that's the sadness, and that is the unfortunate experience that we're having with it right now. And what really amazes me with folk in this particular country is that they keep forgetting. It's not the government trying to create a vaccination to make us zombies or to steal our DNA. It's not just the US. This is a global problem, not just a USA problem. And so that's part of the I guess craziness, but yet that's what makes this so perplexing for me, is that if you want to box this in and say this is the US government trying to take our rights from the US Constitution, but what about what's going on in Sweden and in Africa and in India and in Asia? Like, it's not just a USA pandemic. And so until we, and I think Everett said it the best when some of you all went downtown, I think Kayla was there, and we did the first kind of commercial PSAs around COVID. Everett was like, don't believe the hype. This should not be politicized. It is not a political issue. And until we can grasp that concept as a country and as a nation, this foolishness is going to continue. Because people at the end of the day are going to be more worried about, as Cruz said, the bottom line than they are people's health. And that's very unfortunate. So thank you guys for weighing in on that and for sharing that at this time. So I want to kind of pivot really quick and kind of have you guys kind of go down memory lane and kind of share what were some of the highlights. This is like part 2 of last week's conversation. We did a summer campaign on mental health. And so what are some of the highlights regarding this campaign that you guys may want to lift up, especially some of you all who were not on the show last week? Was there anything out of those shows that we did? We did the body image show. We did the self-care show. We did the show with the LGBTQ plus group. We did several different iterations of what it means to take care of your mental health and defining mental health and really defining it from it is both a positive and a negative spectrum. Go ahead and jump in if you want to give a reply.
Yeah, I'll just reply real quick. I don't necessarily have like a favorite show out of all the ones we did in our little mental health sort of thing, but I just kind of like the whole thing. I like how we had a bunch of different, some of them were, you know, just our FIRE people, but some of them were also people from different organizations and also just other people from our communities. And I thought that it was really amazing that we all came together. You know, we all had different views on certain things. A lot of the times we were able to, you know, find common ground on a lot of stuff too. But I just liked how we were able to, you know, come together and then talk about something that really needed to be talked about. And that we were able to educate like ourselves, you know, on the show. And then like everybody watching at home, I'm glad that they got to see us all, you know, having these conversations that needed to be had. You know, a lot of people don't every day get to see a lot of like really truly like good stuff to learn. Like, I'm
Yeah.
losing my words right now. But it's not every day that you get to learn something. And I'm happy that we got to provide that for people, especially in the world that we have been living in these past few months, where it seems like drama after drama, especially with politics, especially with, you know, all these natural disasters that are happening across the world, all these people who are living in these harsh situations. I'm glad that we got to provide a little bit of light to those people, and to ourselves. It brought up the spirit of me. I'm sure it brought up the spirit of everybody else. So I'm just glad we got to do that.
And I'll say some of the most comments that I got, not only that I saw on the Facebook, but also people like sending me emails and calling me, was about the fact that we really stressed mental health as a spectrum, and that positive mental health is also mental health, and you have to work and put effort in making sure that you have positive mental health. And I think that that was a real good eye opener. Anyone else want to jump in?
Yeah, I'll hop in. One of the key elements that I really appreciated about this, initiative or program that we kind of did was that there was a sense of vulnerability. And we were expressing that in a positive way. We were talking about subjects that aren't necessarily, comfortable to talk about, but they're meaningful. And that could potentially really help impact someone else who, doesn't have someone who has that opportunity to speak about those type of things. I know it's really uncommon for mental health to be talked about in the African-American community. So I like that we were able to take that break, really get into that. And I guess my favorite one would have to be the Jennifer Lewis one, because, that was really cool. Just to have someone, who's respected, especially as someone who's an advocate and using their platform for something good. And she was able to give insight and concern and care and advice. And I really appreciate that element that, this is someone who is being open and vulnerable about the things that, they've gone through. And they were, kind of setting out some guidelines or some barriers that I could follow to, potentially be a positive impact in my own life. So that was really genuine and kind. And, like I said, it's always cool to have those opportunities. But yeah, beyond that, I just really appreciated how we were able to take this, time to really flesh out what it means to have mental health, all the different, aspects from it, and hear voices from all different types of communities.
Anyone else?
I'll share. So I really love the self-care show. I'm a huge fan of self-care and boundaries and all that stuff. And I love hearing about coping skills and things to relax, ways to have good relaxation and like social support. And also on I think it was the LGBTQ plus show, I think someone mentioned just like getting help and seeking help. And I think somebody just like casually mentioned a psychiatrist, because we always talk about, if you want help, reach out to a counselor or a therapist, but also like destigmatizing the idea of medication for mental health. I know in my experience, like, and I share all the time about mental health, but when I had to go through an experience of meeting with a therapist and then also getting a psychiatrist, I found that even I had some stigma within myself, and I'm in this field. And to come out on the other side and feel like, okay, I can go through a journey of medication. I can go through, regular psychotherapy. I can do self-care and stuff like that and still feel great. Like that matters. And it's important to normalize that, because in so many cases, and especially in the literature too, like when it comes to actually getting to a place where you're like, okay, a lot of times you need medication short-term and therapy long-term. And if you a believer like me, you also need some God up in there. And it's not like an either or, it's a both and. And then I think it's great the timing of this, because it's summer. Like in summertime is when we're all like, okay, I'm living my best life. But we're about to go into fall and winter when people are going to look back on these shows and say, oh, boom, that's what I needed. And they'll have them already there. because we know people deal with seasonal affective disorder and all type of stuff over the colder months in this part of the world. Some people are just great all year round, but yeah, just the timing of it was nice too.
Anyone else want to chime in?
I can go.
Go ahead.
Piggybacking off of what Jasper just said, the LGBTQ show was, I really liked that one because it brought together so many different faces and experiences. And we were talking about everyone's intersectionality of how having that identity and then being a minority or being in these other identity groups were just, and how that also drastically affected their mental health. That was an eye-opening experience for me. And there was another one that I think it's a show where you all had your mothers on. And it was very clear to see where you got your inspiration and where you got your resilience and your drive from. I also find that pretty inspiring too.
Awesome. Anyone else? And I'll say, just the fact that we're having this mental health conversation and we're enjoying having it and we're not afraid to have it, and that we're inviting other people into this space is powerful. 5 years ago, young people weren't really talking about mental health like that, right? And I think that even in destigmatizing it to the point to where you don't necessarily have to be on the verge of suicide, or you don't necessarily have to say that you have clinical depression to understand you have to cater to your mental health daily, right? And so I love this conversation and the safe space, I'll put it that way. The safe space that you all created when we started having this series of dialogues, and the work that you guys have done has started to trickle in several different inquiries from other groups and organizations. First, the work that you guys did with your COVID messaging last summer created several opportunities where other people wrote grants and asked you all to be a part. I know Cruz and Kayla and Everett, and I think the Cole and Christian, and I can't remember who else, but they were a part of a group I was working with Martina Sadler and her work. And then many of you were in some of the other things. I know Kayla has also done some things with Dr. Bailey and the Michigan Institute for Clinical Health Research, and I spoke on those panels. And then I know Everett and Kayla did some PSAs that was before the work that we did with Artina. And so people are seeing it. And even today, Dr. Bailey and I got called into a meeting this week because they want to do some things regarding the dialogues that you guys did about racism. And they've already chosen this group to do this work with them. And some funds comes along with that. So these are the types of things that, like I said, you guys you might think, we're only just doing this talk show and okay, where's the action? It's happening. And like I said, because we're so decentralized right now and we can't all meet and huddle at the same time in person, it may not feel like you're making an impact, but you're making an awesome impact. When we talk about what you guys have done with the campaigns, first the COVID campaign that we did last summer, and then with this campaign around mental health. And in between, we have done a lot of great things. We started off in Hamady High School with our first cohort where we were doing our curriculum there. And then we went from Hamady to started working with Youth Quest with the very first summer camp we did. And that's where we got Everett from, right? And we were doing that camp on youth diabetes and diabetes and physical activity. And so they did a photo voice project on the conditions of parks and recreational spaces. And so then we partnered with the last administration under Mayor Weaver and Dr. Pugh, and we worked on some projects creating some marketing information to kind of share where physical activity programs were for kids and for youth. And we also started what we call Youth Unlimited Productions, another component of FIRE, where we're going to branch off into pop culture and music and all of these other things. And also looking at helping other organizations to kind of do a revamp of their website so that it's more youth friendly, more youth engaging. We wrote proposals, taught our young people how to do that. You guys did an awesome thing there. We partnered with Wow Outreach after that, right? And we started working with their youth to teach them how to do focus groups, get them certified to do human subjects research, taught them how to code their data and how to make their final reports. And then we worked with Youth Quest again, right? This past summer, where we did our curriculum, but then we had mental health as a topic this summer, and racism is a stressor on mental health, because we talk about how people of color, racism is a consistent stressor for people of color. And we engaged in youth dialogues, and we did a wonderful dialogue there. And then at the top of this year, we did a thing about the importance of mentorship. And we talked about Martin Luther King, the mentor, the man, and the message. And we did that with Mott College funded a group of us, from the Alpha Esquires to the Delta Gems, Big Brothers, Big Sisters, and FIRE, and others. And so you guys have done a lot of stuff. And I just wanted to kind of overview that, because oftentimes we do so much that we don't realize what we do, so we don't take time to celebrate it, right? We don't take time to pause and say, how did we do all of that during COVID? Like, how did we do all of that? And the majority of that was done when we couldn't even be in the same room together, right? And so you guys are doing awesome things. And so I wanted to kind of recamp that. And as we are closing out, I wanted to kind of ask you guys a question. Prior to being a part of Flint Public Health Youth Academy, and then now that you have been engaged in it, how has that impacted your view, not only on public health, but just how you live your life? And I see someone says, Amir, go first. So Amir, go first.
Personally for me, before I started this journey, probably about 2 years ago, I'd say, getting transitioned and everything, I kind of did have some sort of idea of what, like the medical stuff I was doing in high school, taking classes, all that type of stuff, but like public health and the way when you're going through it. And I was with Cruz and then another person that is also in this group to start off with. And I think it was cool, like learning that, like different curriculums and all different type of things, like there's just like different lessons and that you can take with you for like a long period of time, and really try to really improve on your life, and really can improve on everyone else's life outside of it, And I feel like also the engagement with different other organizations was really a cool thing to see how we can branch out and really spread our message, and kind of, really give youth and other young people just the idea of what public health is. Because a lot of people in Flint and other cities like that, they don't really know what public health is. They're not aware of it. And I think it was a really good experience for me to really get involved and really just try to make a difference.
Thank you. Anyone else want to share?
Yeah, I'll pitch in. I think what this has given me that like is most obvious to me is like a name for a lot of different things that I didn't understand the title of. Because prior to working with the Flint Public Health Youth Academy, I had been active in the city of Flint with several other nonprofit organizations, but working specifically within the public health field and being able to speak about public health issues put like a name on several phenomenons that I didn't necessarily understand. Like, for example, the racism as a public health crisis work that we've done is like, so like I've dealt with racism, I've experienced racism, I've seen racism, right? But it's not, I've never been able to say like that's a public health crisis, like, because that is and being able to explain that, right? And being able to say, like, in the same way that like a pandemic is a public health crisis because it spreads, because it has these attributes, in the same way, like being able to draw those parallels and put names to it. I think oftentimes it's, as a young person, we oftentimes aren't given the credibility, right, to have platforms and to be able to use our voices, and for our expertise to truly be appreciated. And so I think this platform gave me the opportunity to speak with a certain kind of authority that I didn't necessarily always have, even though I was working with in the social justice field and working with other nonprofit organizations. This gave me the platform to be able to speak personally with large groups of people, with authority, and feel like a credible source of information and of knowledge and of wisdom for others.
And that's so funny, Kayla, because one person asked me what is public health? And I just simply said, public health, it's a science. But if you need a description, public health is the place where medicine, community, social justice, and law meet. It's that intersection, right? And when I say community, I mean housing, transportation, built environment, all of those things. It's that nucleus where all of those things intersect. And so thank you so much for your feedback, Kayla. Anyone else?
I'll go.
ahead.
For me, public health and FIA were like a magnifying glass that helped bring clarity to, the types of things that I was involved with and that I found important. So like it helped like chart out and make more sense of things that I was passionate about, if that makes sense. And so it was like, I care so much about social justice and helping others. And I care about how I can, make these things possible to help uplift others. And I found that through policy and public health. I found that through understanding how populations work, and understanding how there are health disparities along with, societal things, along with institutions. And public health has a role in all of those to some form. And then that helped me realize like, okay, so these are the things that I kind of want to do. And if I'm not considering public health while I'm doing them, I won't be doing them to my best ability. And I potentially won't be able to allow for them to actually function and work properly in a sustainable way. And so whether that be, helping make art that shifts people's minds, if I have context of public health, that can really be powerful. And that can, help uplift voices or speak about topics that, that aren't common, like how we were talking about mental health. That is super important to me. And so the fact that I now have like an idea of how that incorporates into everything else that I do, I can show more concern about it, and I can make sure that others are aware of it too.
Thank you, Cruz. Anyone else?
Yeah, I'm pretty similar to everybody else. Prior to being in FIA and like participating and going through all the stuff that we went through, I really didn't have like a huge understanding of what public health was. I knew that it existed. I knew that there were certain things in life, happened, but I didn't necessarily know why. Through public health, I got to kind of see the behind the scenes in a way, and got to, gain understanding of why politicians did what they did, why doctors do what they do, why like the mental health people do what they do. Like I got to understand it, and I got to, formulate my own opinion on it rather than just consuming other people's opinions, which is like one of the strongest and biggest things for me is, because I was like, I think I'm like the youngest person in the group. So like my whole life, I've always been like kind of consuming other people's opinions, what my parents tell me, what teachers tell me, what I hear from other trusted adults. And now I feel like I get to be in sort of the same space as them, where I don't always have to, 100% adapt their opinion on something. I get to get in there and like look at the details, see what's really going on, and then adapt my own opinion, so that I truly understand, what I'm talking about, what I'm learning, what I'm seeing. And that was one of the biggest things.
Cool. Thank you, Everett. Anyone else?
I'll chime in.
Sure.
So it's funny because having wrapped up like a degree in public health at a world-renowned institution, I felt like I had a good sense of
What
like
institution was that?
Harvard University.
Okay, I'm just saying. I just want them to know that people like us can go to Harvard and graduate too. Go ahead.
Okay. But I felt like, I had a good sense graduating. Like I got a good sense of public health, and this has really been an extension of my education. It's like I had a Master of Science, and now I feel like I have an MPH too. Like getting just all these good conversations about public health, and in addition, it's been like a safe space because you can sometimes look around and read the news, and it's like, okay, nobody's thinking about public health. Nobody's thinking about what makes sense, what's going to keep us healthy. We're in a pandemic, and people fighting about whether or not we want to protect one another. So it's been like a safe space and a place to say, okay, so I'm not tripping. I'm not. This is real. This is all necessary. And then it's been like inspirational and kind of like a confidence booster too. I know Kayla talked about just having that sense of like credibility, like I'm doing something, sharing high quality information with my community, and it's inspiring to want to learn more and do more. And it's been nice to be a mentor for youth again. I took a little break from it officially when I was doing school, and then I had to circle back, but it's nice to be able to be a mentor and to help make it so that like I learned about public health through studying public health, but I didn't know a phrase for public health. I didn't know the term public health when I was you all's age, and the age of maybe some people who are watching the show. And so to be able to be a part of making sure people know what public health is, are interested in public health, and can find a way to connect it to their like to the way they live their life and their passion, like that's dope. And it's a group I get to brag on. Like get to tell folks like at Harvard, like y'all need to hear about this Flint group. Like these youth are doing it, okay? And I'm gonna keep on doing it.
Awesome. Anyone else? And there's no pressure. Everyone doesn't have to answer. Would anyone else want to chime in?
I guess I can add something.
Uh-huh.
I guess after I got introduced to public health, it made me realize that the path I was going on before, I don't think I could ever feel satisfied knowing that I did enough for the people that I was intended to serve. So having that inspiration and that drive to actually expand what I was going to do before into maybe doing something like this in the future, I think that's kind of where my like destined path should have been. Like having this introduction just made me realize where I actually needed to go, where I thought I was going. And then FIA specifically made me realize that if you give someone a platform where they can be heard and their voices are amplified, you'd be very impressed and surprised what people have to say, especially this group here. All your talk shows have been in some way inspiring and making me think and like invigorating. Like being a part of this has been a great experience for me.
And I like to say, so Dr. Bailey is the one. We were having a oral health fair a couple of years ago before COVID at New Jerusalem Church at the Kofi Center, actually. And Dr. Bailey knew Khalil's grandmother. And she said, Dr. Key, there's a young man I want you to meet. I want you to mentor him. And he's going into medical school, but I think he needs your mentorship. And so I'm thinking like, Dr. Bailey, I got enough. I had Ishmael, I had so many, but I'm like, okay. Some people, they just voluntold you, like voluntold. Like told is mean past tense. You don't have no say-so in it. And so anyway, I'm like, okay. So I met Khalil. He started coming up to MSU certain days out the week, volunteer, not for pay. He wanted to learn about public health. I gave him some assignments, some things he was doing for us as far as, some of the programs and doing some things. Then after I saw he was really serious, I linked him to a project, the Church Challenge and some other stuff where we could actually then hire him in to MSU, and he became an MSU employee, and he's still at MSU to this day as he's preparing to go to medical school. And so doors of opportunity happen. And oftentimes with public health, it kind of finds you quicker than you find it. And that's how it was for me. I was an engineering student going to Kettering, right? Who go figure. So I say that to say this, that once I learned about public health and realized that public health was everything, then when I did my dissertation work, I wanted to make sure that I was able to create something that would allow other young people to be introduced to this field at an early age. And so from that dissertation work, the Flint Public Health Youth Academy was launched through my fellowship with the Robert Woods Johnson Foundation. But you guys, your show has taken this to another level. Because of this show, we now have Los Angeles and the Oakland area who want to do public health youth academies there. So we'll have some California public health youth academies. We have the Brooklyn Public Health Youth, we call it the Brooklyn Fire, but Brooklyn Public Health Youth Academy. There's a couple of people in Atlanta, and there's a school that I have been mentoring in Atlanta. I've been working with their 6th grade teacher. They want to do a public health chapter there. There's another one, I think you said in Mississippi, if I'm not mistaken, Dr. Bailey, that reached out to us, and it's like 2 other places. And so we're looking. So for those of you who are watching this in social media land, if you got money and you got some big funds you need to allocate somewhere, we will take them. If you're in philanthropy or just a rich donor who's looking for something to invest with young people, we're preparing to launch the National Public Health Youth Academy. And under that National Public Health Youth Academy, we will actually have these chapters, and these young people who you are seeing on this screen will become basically regional coordinators for those chapters, depending on where they are. And so we really do have some big plans to really broaden the reach and the scope to utilize our curriculum, that we've developed a full curriculum around public health, as well as some of the research opportunities, some of the policy and advocacy training, and then some of the platforms that we're doing. And we hope to host in the next year or two a national, or probably will be virtual, but our first national youth summit sponsored by the National Public Health Youth Academy, of course, with Flint being the headquarters, if you will. We really focus on racism as a public health crisis. So some exciting things are happening with these young people. So again, if you have some resources and some funds, or just want to be a part of helping to launch this national work, contact us. You can contact me at keykent@msu.edu, keykent.msu.edu. Well, at msu.edu. And you can also contact us on Facebook. If you need some keynote speakers, contact us. We have been sending these young people out, and they've been doing a lot of keynotes on different mediums and all of that. And so let us know, and we're excited. So we're coming up on our hour. This has been an awesome talk show. Again, reflecting on what we've done so far and the impact of the 2 campaigns, our COVID campaign that we did last summer, our health messaging and communications campaign, as well as this mental health campaign. As you guys can see, the Flint Public Health Youth Academy, we're on fire, and we are ready to really bring a light to what public health is and to what every individual can do in the field of public health. We're looking to engage and to take this talk show to a podcast, as well as, so if you know how to do that work or have resources and would like to donate and that to the Flint Public Health Academy, let us know. But many of these young people are also singers and musicians and poets and all of that. We're also talking about our intention to then take public health to pop culture. And really, what role does music, what role does art, what role does fashion, what role does all of these things play in communicating messages around community health? And so we're excited to expand our borders and to go into those territories. So again, thank you for tuning in to this week's episode of A Youth Perspective. We're here every other Friday at 6:30 on Facebook Live. We will see you next time. See y'all later. Have a good one.